Hello friends, welcome to the channel Nursing Brains. Please do subscribe to our channel if you had not yet subscribed. It just takes 1 second and it encourages me a lot to do further videos. Today let us go and discuss about vitamin B1. So, vitamin B1 is one of the vitamin from the B complex. Vitamin B is a water soluble vitamin which has 8 components. They are B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folic acid, B12 cyanocobalamin. So today let us discuss about B1 thiamine. Vitamin B1 is also known as thiamine. Thiamine is discovered in 1897. It is available both in dietary products and also in the form of drugs. It is an essential micronutrient that cannot be made in the body. Thiamine is required for metabolism of glucose, amino acids and proteins in the body. So thiamine is available in the form of drugs and dietary products. See, what are all the dietary products thiamine is rich in? Thiamine is very rich in some of the cereals and pulses, especially rice, that is brown rice. So coming to pulses, we can see in peas, we can see in beans, nuts. Also, it is very rich in wheat and wheat products, milk, meat, seeds and nuts and also pumpkin. So the daily dietary requirements of thiamine are: for children, it's 1 to 3 years 0.5 mg per day, 4 to 8 years 0.6 mg per day, 14 years and older 1.2 mg per day, 14 to 18 years 1 mg per day, adults over 18 years 1 milligram per day, for pregnant women 1.4 milligram per day. These are all the dietary requirements of thiamine on daily basis. So, let us discuss about the health benefits of thiamine. What are all the health benefits of thiamine? It helps in energy production, especially in the process of metabolism. It improves appetite and memory. It helps as an anti-aging factor, reduces the risk of Alzheimer's disease. It aids in production of red blood cells, helps in digestion, prevents cataract and improves memory. These are all the health benefits of thiamine. So, it improves appetite and memory, production of red blood cells, prevents cataract and improves memory. So, what are all the deficiency disorders of thiamine? Thiamine, the deficiency disorders are Beri, burning food syndrome, Wernicke-Korsakoff syndrome. So, Beri is due to taking of excessive white rice, that is white polished rice. Burning syndrome, it is also known as Grigor-Gopalan syndrome, which is due to the dialysis and there was excessive swelling and edema of the foot. And Wernicke-Korsakoff syndrome is due to excessive taking of alcohol. Then coming to Beri is also known as extreme weakness. So Beri is considered as the extreme weakness that was seen in the people who had thiamine deficiency. It is divided into two types, that is dry Beri and also wet Beri. Coming to dry Beri, what are all the symptoms of dry Beri? Degeneration of long nerves of both arms and legs takes place. Muscle atrophy, that is a damage of the muscles. Loss of reflexes, tingling sensation in the feet, paralysis and also mental confusion or delirium or the symptoms of dry Beri. Coming to wet Beri. Wet Beri, the symptoms are edema because of fluid accumulation, cardiac failure, shortness of breath, rapid heart rate. So Beri is because of consumption of excessive white polished rice. So parboiled rice is very good to prevent thiamine deficiency, as parboiled rice is very rich in thiamine. So this is about Beri. Coming to Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is also known as wet brain, as this is because of taking excessive alcohol. A person who is taking excessive alcohol consists of thiamine deficiency. So chronic alcoholism leads to thiamine deficiency, which leads to the death of brain cells, and this leads to certain set of symptoms, that is two set of symptoms. One is Wernicke's and one is Korsakoff's. And in Wernicke's we have the symptoms of confusion, ophthalmoplegia, ataxia, whereas in Korsakoff's amnesia, confabulation and psychosis. Amnesia, loss of memory, confabulation, filling the gaps of the memory, and also psychosis. So this is about Wernicke-Korsakoff syndrome. This is also important in psychological part of view. So Wernicke-Korsakoff syndrome is also known as wet brain. This is because of excessive alcoholism. What is the treatment for thiamine deficiency? The treatment for thiamine deficiency is mainly B1 supplements. How can we supplement the B1? So this is the dietary intake of adequate amount of thiamine rich foods, avoiding consumption of white polished rice, especially taking parboiled rice is very good, avoiding alcohol intake as alcohol leads to thiamine deficiency, and administration of 50 mg parenteral thiamine for long therapy treatment to avoid the deficiency of thiamine or to treat the deficiency of thiamine. After expected recovery, we can give 10 mg per day, that is on daily basis. So this is a treatment for thiamine deficiency. So excessive intake or adequate intake of thiamine rich foods leads to develop thiamine in the body. Coming to AIIMS based important questions. What are all the AIIMS based important questions from B1 thiamine? Vitamin B1 is also known as thiamine. So vitamin B1 is also known as thiamine. Burning food syndrome, which is caused by thiamine deficiency. So thiamine deficiency leads to burning food syndrome. It is seen in especially dialysis patients. This is also known as Grigar-Gopalan syndrome. Delirium caused by thiamine deficiency is seen in dry beriberi, and Wernicke-Korsakoff caused by thiamine deficiency is also known as wet brain. So Wernicke-Korsakoff is also known as wet brain, and delirium caused by thiamine deficiency is seen in dry beriberi. So the symptom of dry beriberi is delirium. So delirium is one of the symptom of dry beriberi. Then coming to next questions, consumption of white polished rice leads to beriberi. So consumption of white polished rice leads to beriberi. Consumption of polished rice is very good, and also during cooking rice we should not throw the excessive water, and we should not wash the rice for a long time, because the thiamine will be loosed off in the water. So excessive consumption of alcohol leads to Wernicke-Korsakoff syndrome. And what is an anti-beriberi factor? Anti-beriberi factor is vitamin B1. Vitamin B1 is also known as anti-beriberi factor. Excessive intake of alcohol causes deficiency of which vitamin? B1 or thiamine. So anti-beriberi factor is vitamin B1. Excessive intake of alcohol causes Wernicke-Korsakoff syndrome. That is due to the deficiency of B1 or thiamine. And consumption of white polished rice leads to beriberi. So thanks for watching. Please do like, share and subscribe and comment, and please do subscribe to our channel. Thank you.